Hi everyone, Dr. Nemechek here. And I want to just review, what does autonomic dysfunction look like? Like, what kind of symptoms do you get? Well, you'll be surprised at how common these symptoms are. All right? Now, your autonomic nervous system regulates all your organs, your blood pressure, your heart rate, your emotions, your immune system, your metabolism, your emotions. Okay? We'll just talk about a physical injury, but you can also have inflammatory injuries and emotional injuries. But say you get hit in the head with a baseball, okay? You shear some neurons. Many of the symptoms that people complain of are from the autonomic nervous system not functioning correctly. And you can break it down to two general categories. One is the intestinal tract slows down. So in the first week, you can have about 50-70% of people suddenly are constipated. That's because your colon slows down. Or about 30-50% of people have heartburn or nausea or reflux of acid. Why? The stomach slows down. You can have cramping of the small intestine. That's called irritable bowel syndrome. Some people get sticking food here. Some people get tightness here in the throat. It's called globus. These are all symptoms of the intestinal conveyor belt, if you want to view it that way, not working correctly. So that's one. The other main mechanical thing is we have trouble generating the proper blood pressure up, if this is your head, up into your brain. Okay? There's two ways. There's an internal blood pressure system in the brain, and that is augmented to a great degree by the body pushing extra blood up into the brain. Now, what happens if you don't get pressure to your head and neck? Well, there's three kind of things. The brain doesn't work right. So low pressure to the brain means low oxygen flowing into the neurons. You can't think right. You can't focus right. This is attention deficit disorder. People will say their balance is off. They stand up occasionally, get lightheaded. That should never happen, folks. I hear it all the time. It should never happen unless you're extremely dehydrated, like vomiting and diarrhea for a couple days, okay? Lightheaded, bounce off, can't focus, can't think. You get a reaction from the brain. In this response, the brain will release a stress hormone called norepinephrine. Now you're kind of panicky, anxious, maybe grumpy, aggressive at times. You don't mean it. All right? The brain doesn't like this. The brain makes you carve salted sugar. That boosts blood pressure to your head. Your main brain makes you want to drink a lot of water. Why? That boosts blood pressure to your head and gives you more oxygen. Think about it. All these people walking around with these great big, Stanley jugs of water all day long. Drink, 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 drink. When I was young, nobody did that. Why? People could recover from injuries. They can't recover from injuries now because of inflammation. But anyhow, those are the brain symptoms. Your muscles won't get, of your neck and your scalp won't get enough oxygen due to this lack of pressure. Folks, this is all headaches but a sinus headache. I don't care if you call them migraine headaches, cluster headaches, tension headaches. These are from low pressure in the scalp muscles. All right? In the neck, it's called coat hanger pain. You're working on something important, doing the bills, writing a paper, sitting on an airplane, long car ride, the neck's just killing you. That's from low pressure. Get up, move around, kind of gets better. Go ride your bike, better. And then the third main thing is the nerves coming from your upper cervical spine. They won't get enough oxygen either. It's called neuronal ischemia. And so you can have from the hands, shoulders, face, mouth, this kind of waxing, waning kind of numbness. It's kind of hard. You might get a nerve conduction study by the neurologist. It's normal. This low pressure just kind of, the nerves don't get enough oxygen. It doesn't hurt them. It's more like if you cross your legs funny and your foot falls asleep, it doesn't damage the nerves, okay? And so it's transient. That's what autonomic dysfunction looks like. Can't think, can't focus, I'm anxious, I'm kind of hungry, I'm gaining weight, I'm fidgety, I'm trying to move my muscles because body, that'll drive blood pressure. I got these headaches coming and going, my neck hurts, I got these funny neurological symptoms. The neurologist thinks I'm crazy. And you know what, folks? When you go lay down, you You get rid of gravity. You get pressure to your head. Most all that goes away or is a lot better in 30 minutes, isn't it? Or an hour. Right. It's the only thing that gets better like that. No other neurological problem gets better when you lay down, unless it's low blood pressure of the head. So anyhow, these are super common things. This is, you take 5 of your friends, 2 or 3 of them have these problems. It's really common. We're getting brain injuries we can't recover from, but if you just lower your inflammation, your brain can still fix it, all right? 2 tablespoons of COC olive oil every day. DHA fish oil, I recommend Now Food or a Nemechek Silver brand. Got to balance the gut. Adults, inulin can help some. Rifaximin works better. That's hard to get. Most docs won't help you with that. If you need it, maybe come out to Arizona once and I'll get you all set up and we can get you recover. And then the older you are, the more likely you need vagus nerve stimulation. So I hope that helps everybody. Take care now. Bye.